listening to Up to Speed on CBC Radio 1, 89.3 FM in Winnipeg. I'm Sam Sampson. Well, as you've heard in the news, Manitoba Hydro's Keeyask site is now in the red or critical level of the province's pandemic response system. The province made that call yesterday. Hydro says 23 workers at the Keeyask site in Northern Manitoba have confirmed positive cases of COVID-19. Another 8 workers are not clear and are awaiting their test results. Hydro says all close contacts are self-isolating, and there are 55 workers isolating in dorm rooms at the construction site. The Keeyask site is between several communities in Northern Manitoba, including York Factory First Nation. Chief Leroy Constant is on the line now. Good afternoon.
Good afternoon.
Thank you for coming on the show today. What are your major concerns about how Manitoba Hydro is handling the COVID outbreak?
Yeah, the biggest concern is the accountability part. We've been having to notify our members on site that are at the camp, and we've been having to report the numbers to them that we've been receiving from public health, and Manitoba Hydro is keeping them in the dark on site at site. So that is a big concern from the First Nations that we're doing their jobs, and they should be accountable for their workers on site.
Manitoba Hydro told us that any claims that they are not communicating with First Nations are, quote, simply not true. What do you think of that?
Well, again, we have to beg for information. We always do our best to communicate with members as much as we can. And again, we're seeing that this is not happening at the site.
I understand there are 35 people from your community who are on the Keeyask site. How many are affected by COVID right now?
I guess in a good news part that none of our members have tested positive. So, keeping our fingers crossed that nobody does show any sort of symptoms or does test positive.
How many of your members? So I understand that some of your members, go back and forth to the project. How many actually live in your community?
Yeah, of the 35, we have 11 members that reside in the community, and there is a couple of them that did return home, but we have them in the isolated site back home for 14 days.
Mm-hmm. Okay. So what happens if someone who is connected to the Keeyask site? What happens if someone from your community tests positive?
Obviously, we just have to follow the public health orders that are in place, and that's unfortunately all we have to do. But if they're needing urgent medical care, our nearest hub is Thompson, and again, that the Northern Health Region is at very high risk for no resources. We don't have any sort of resources in the area, so if they're needing urgent medical care, they'll have to be sent to the Winnipeg Health Region, which is also looking to be at a max capacity right now. So very concerning. We don't. We're hoping that anybody from the Keeyask project that is from a Keeyask Cree Nation doesn't have to go for secondary medical care and can recover at home.
Mm-hmm. What are you hearing from folks about how they're feeling right now about all of this?
So again, they're asking for answers. They're asking daily on what is the update, because they're not getting it at site. So again, the communication part is not happening on Hydro's part. They are to report to their contractors, and their contractors would relay information, but they're doing it on a daily briefing, which is very vague. It doesn't really report accurately, we feel. We've asked them to recreate a document that goes up daily to more reflect the COVID numbers in camp. So there was 31 cases we were made aware of. We're treating that 31 number as positive, as advised by public health. So the individual was on site since October 10th, and we're using the October 20th date of the infection date. So anybody that's come in contact with this individual would have to self-isolate for 14 days. There's options to isolate in the Thompson region at hotels, or if they choose to come home, there'll be strict guidelines on them getting home. Again, so yeah, we just a lot of uncertainty, a lot of fear. People don't know how to feel. People don't know what to think about the whole situation. So very concerning coming from our community, for sure.
When you talk about the lack of transparency and communication, I want to read some of what Manitoba Hydro sent us after we raised your concerns with them. They said, a spokesperson said, Manitoba Hydro took immediate action to address the presence of COVID-19 to test and trace all on-site staff and prevent the spread of the virus. Few organizations have undertaken the scale and scope of measures we have as fast as we have. So that's a direct statement from an email we received from Manitoba Hydro. You say that you want more communication and more communication within the site. Do you have any specific idea of how they might be able to do that?
Well, I think that what needs to happen is they need to communicate with the leadership directly so we can inform members in a timely manner, because what's happening is that they say they're communicating with us, but we don't receive the information until public health notifies us. So, again, the communication part directly to us has to happen, because we're not getting it directly from Hydro unless we demand it. It shouldn't have to be like that. We're a partner in this project, and we're left in the dark.
Yourself and other chiefs, I understand, are calling for Prime Minister Justin Trudeau to step in. Here's what he said in question period in Ottawa earlier today.
Mr. Speaker, we are obviously concerned by the outbreak of COVID-19 cases at the Keeyask generating station, and we're monitoring the situation closely. We expect work on the Manitoba Hydro project to follow public health advice to keep workers and Indigenous communities safe. We will support First Nations leadership in working with their partners on measures appropriate to protect their communities.
What do you think of his response?
Yeah, again, obviously acknowledge his remarks. We've been in touch with the Minister, Mark Miller, who is in charge of Indigenous Services Canada region. So, it's definitely gone up the chain now, and I think this is, we've reached out to the Premier in regard to a response to the outbreak. We have received no response to date, nor have we received a response from the Health Minister in Manitoba. So, again, we're very disappointed in Manitoba's and Manitoba Hydro's lack of response in this outbreak at the project.
I also understand there are concerns about testing. Hydro says they're engaged in testing and tracing, have stopped the inbound movement of most staff, and will continue to update their plan as the pandemic evolves. What more would you like to see Hydro do?
Well, okay, so we were made aware yesterday of approximately 20 workers that would come in and act as a critical care type of employees that would come in and kind of take care of things while everything's kind of on a minor shutdown. We're not sure on the amount of workers that are currently at site or required to keep Keeyask moving construction-wise. So again, we're just in a bit of a bind here, because when Manitoba Hydro said that all inbound workers is stopping, bringing in 20 more people is not stopping that. And in their statement, they're not honoring that statement. So again, it's contradictory to what they say, and their communication is to us as leaders, as well as the people that are employed at the Keeyask project.
Before I let you go, you said something a couple of minutes ago. You said we're partners in the project, but we're left in the dark. Do you think that once we work through that COVID outbreak, do you think that the communication between yourself and other partners and Manitoba Hydro, how do you think it will be affected?
Yeah, again, we've been dealing with Manitoba Hydro on this Keeyask project for a number of years now, and again, we're struggling. I'm just going to say it outright that we have a lot of troubles giving direction to Hydro. We're outnumbered at the board, and decisions are made prior to us even knowing about it. So again, it's a very one-sided how the board is structured. So it's going to be very challenging moving forward because we're asking for the shutdown of the camp. Just to contain the outbreak. You got to understand that how many people the Keeyask project employs within Manitoba. We can identify Keeyask as a super spreader right now if they're not shutting it down. There's many people from many hubs in Manitoba, like Brandon, Winnipeg, and the PAW, like the hubs of Manitoba that are going to be affected by this if they don't shut it down.
Thank you very much for your time today, Chief Constant.